Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about another treatment option that people are questioning about. I was talking with some patients of mine, and the question came up about pulsed electromagnetic uh, field therapy, so PEMF. PEMF is a treatment that has been around for a long time. It is designed to improve the functioning of the nerves, improve the functioning of the body through a pulsed electromagnetic field. Now, the body functions in a pulsed electromagnetic field anyway. There are some studies that show that you can actually, by creating a magnetic field across certain tissues, you will cause repair and regrowth and so forth. This has been used, for example, with certain types of bone stimulators to stimulate healing by creating electrical current. It'll actually cause the bones to heal. The interesting thing about this is creating an electromagnetic field across the nerves can cause similar beneficial effects based on studies. However, there are some big questions here. What is pulse or PEMF, pulsed electromagnetic field therapy, and does it work? So as I was going through the studies, there's a couple different things you need to know. Not all PEMF therapies are exactly the same. There's actually two types. There's low-level PEMF and there's higher-level PEMF, and they have different reasons for use, different benefits. They really function similarly in general, but they're actually used for different purposes. First things first, PEMF is designed to increase blood flow. By creating that current, it's actually going to cause an activation of the cell membrane or charging of those cell membranes. The cells will move apart. That increases oxygen absorption, increases nutrient resorption, and that's kind of the idea. This is really low-level PEMF, and it actually works really well in that case and can be used for full body use, for example. However, there's also higher level. So you say, okay, let me get a stronger PEMF therapy. That's a problem because it works better on muscle contraction than it does on charging of the cells. And so what it's going to do, it's going to be more beneficial in local treatments of localized pain or localized areas of pain and so forth, and not as effective on the more general body therapy. It's going to also increase blood flow, but usually to the local area, and it will cause some muscle contraction in that area. So low level is probably what you're looking for when it comes to peripheral neuropathy. Because of the two different types, you want to be able to be more general and be able to treat a wider range of areas, not to say, okay, I'm going to treat this one spot of this one nerve. Does it work? Well, they've actually shown through multiple small studies that you can actually apply PEMF directly to the bottom of the feet, for example, and improve the sensation or improve the pain sensation in diabetic patients, so they'll have less pain. So there is some analgesic effects, some anesthetic effect where it doesn't hurt as much. That's when they've seen the biggest benefit is in some cases it will reduce pain, and in doing that, it actually can be beneficial in some individuals. The other question about that, though, is this always effective? What we have found in the studies, there is actually one large study that shows that PEMF is not effective in anybody in that study. So that study actually showed that it didn't have any beneficial effect in any significant way. And so they were unable to say, okay, this works. So you've got smaller studies saying yes, that it works, and in some individuals it works, and in other individuals it doesn't work at all. There's a large study that says it doesn't work at all. Is PEMF valuable? Truthfully, I would say if you're going to do PEMF therapy for your peripheral neuropathy and it works for you, then it would be valuable. But when would you be doing it, and why would you be doing it? Well, it really comes down to the fact that you're going to do it to increase blood flow. You're going to do it to possibly reduce your pain. And really, it can be beneficial in some individuals in some cases. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget day 285. Let's just say PEMF therapy is not a therapy that I'm actually currently using in my office. It's not a therapy that I'm going to pull into my office to use because I can't find enough beneficial results to justify the cost or justify putting people through this. So we're not going to do it right now. It's Dr. Brandt Gibson. Have a great rest of your night.